Mrs. Pass. My name is Allie. I'm going to be your nurse today. Can I have you confirm your name and date of birth for me?
Lily Pass, October 9th, 1975.
All right, perfect. Go ahead and raise this bed so come forward with me. So today we are going to be inserting an indwelling catheter. It is a little bit of an uncomfortable procedure, but I'm going to try to make it as quick as painless for you as possible. And do you have any allergies specifically to latex or iodine?
Nope.
All right. So the first thing I'm going to do is put on gloves and get you all cleaned up so we can keep this area all clean. Go ahead to this first area. Just going to put this pad under you just to keep your bed dry and clean. And then before we begin, I'm gonna ask you to spread your legs and raise them up for me a little bit, just to make it a little bit more accessible and comfortable for you. Although it may not be comfortable right now. All right, we're just gonna go ahead and get you all cleaned up. Cleaning the perineal area. Now we'll just clean the surrounding area. All right, now I'm just gonna go ahead and dry. All right, you feeling okay?
Yes.
So I'm now gonna go ahead and get my sterile field all set up. Bed. Alright. And then is it okay for you if I leave this bag next to you to use as a waste receptacle?
Yes.
Alright, I'm just gonna set that right there. The first thing I'm gonna do is put on my sterile gloves over here. Now that my gloves are on, I'm going to go ahead and get these drapes set up just to keep your area all clean and dry. And then I will not be using the fenestrated drape today just because it's up to nurse's discretion and I find it to be. So the first thing I'm going to do is I'm going to go ahead and attach my syringe to the catheter. Remove the cap. Alright. And then would you like to use any anesthetics today?
No, I'm okay.
Alright. Go ahead and fluff out my cotton balls. And pour iodine over them. I'm also going to be getting my lubricating jelly out and ready. All right, now it's almost time, but the first thing I'm going to do is I'm going to clean up the area. Surrounding area. Make sure to go top to bottom and inward to outward. All right. And then at this time, I would also offer anesthetics, but since you opted not to, we won't be doing that. So now we are going to go ahead and insert the catheter. So the first thing I'm going to do is apply my lubricating jelly, about 1 to 2 inches. And then as I am inserting this, I'm just going to ask you to take deep breaths for me. All right. All right, urine flow has started, which confirms that it is in the bladder. So I'm gonna go ahead and go in 1 to 2 more inches. All right, now I'm gonna go ahead and fill the balloon. All right. Now that the balloon is in place, I'm going to tug, and I can confirm that there is resistance. So now I'm going to go ahead and get this area all cleaned up. So now we are going to go ahead and hang the catheter. Go ahead and put your legs down as well. There you go. Is that comfortable?
Yeah.
Alright. This on the bed, and I'm going to apply a thigh strap just to keep the catheter in place. Alright, and we will be removing that as soon as the doctor says that it is okay. Is that a good position for you there?
Yep.
Alright. So a couple days later, the doctor has ordered that we are able to remove the catheter now. So I'm going to go ahead and expose the area. And before I remove the catheter, I am going to have to empty the urine and assess urine to make sure that you are healthy. So I'm going to get these gloves on, and then I'm going to place a disposable pad under it to keep the area clean. And I'm going to use this to remove the urine. Alright, now that it's emptied, I'm going to be assessing for color, odor, and amount, and dispose of that according to company policy. Dispose of that as well. Now I'm going to go ahead and place this waterproof pad under you to keep your area all dry. I'm going to go ahead and ask you to lift up your legs again. Thank you. Alright, go ahead and remove that thigh strap. And now I'm going to attach my syringe and let gravity do the work. I will not be pulling on the syringe. There we go. Water is being filled back up into the syringe and leaving the balloon. Going to make sure it's completely deflated before I try to pull. All right. Now that that is deflated, I'm going to go ahead and ask you just to take deep breaths. I'm going to go ahead and remove the catheter now. Excellent job. Go ahead and dispose of that. Cover you back up. And do you require assistance with perineal care today?
No, I'm okay.
All right. Go ahead and get your blanket back on. Go ahead and lower the bed. Your call light is in place right here. I have placed all your possessions on the bedside table next to you. I have the wheels locked, and I am lowering the bed now. And now the bed is in the lowest position. Is there anything else I can get you today?
Nope, I'm all good.
Have a wonderful day.
Thanks, you too.